Hi, my name is Sal Carceller. I'm a resident of Portsmouth, Rhode Island, and I wanted to better understand COVID-19 breakthrough cases in the state of Rhode Island. And I went to the Rhode Island Department of Public Health. This is the website. You can go there yourself. And this is the only chart and only page that has any information on breakthrough cases. And I found this stacked line chart where they try to convey fully how many of the cases in Rhode Island that come up positive are fully vaccinated versus unvaccinated. If you look at the chart, it's week by week, so all the data's in here for every week. The numbers are here. You can hover over them and pull them out yourself. So the good thing is, since the numbers are here, they're easy to pull out, and I did that. But before I explain that, the thing with this chart that's caught my attention is that it's cumulative. All right, which means they started counting positive cases way back here in January, and then just started accumulating the case counts all the way up to present day. So if we look at the last report that they have for September 19th, they're basically saying the cumulative tally is 54,000 cases, roughly, right, for unvaccinated, and for fully vaccinated, 6,500. Roughly. Now, I did the math really quick back of the envelope, and if you look at this, it leads you to believe the average person that, at the end of September, your chances of coming up positive compared to those that are not vaccinated, this is 10%. So the red right here is 10%, and this is 90%. So this got me thinking, the casual observer would think, well, boy, I better go get vaccinated because, I'm better protected. And those that are already vaccinated, they feel good about their decision, saying, well, it looks like it worked, right? I'm well protected. Now, the problem is I've done quite a bit of statistical analysis and charts like this for a living. This is what I did for a day job. The thing that caught my attention is cumulative. Cumulative charts like this are not very useful for trend analysis. And so I'm just going to show you that I took the data off of here. I'm just going to bring up a PowerPoint. I'm going to give you the summary. So this chart is their chart. The exact same numbers I pulled out look like this on a weekly basis. So if you look at, for example, September 12th, and you compare, percent numbers are very misleading because I could play games. So I'm telling you here, it's 51%, right? But who cares about the percent numbers? Let's not split hairs on how we calculate percent. The bottom line is for the week of September 12th, there were 758 positive COVID tests, and 758 of those were in vaccinated individuals. And for what we call, I don't want to call them unvaccinated, it's not fully vaccinated, because a lot of people fall into this category. We can explain that later. But the bottom line is, from their own numbers, there were 1,472, all right, that were not fully vaccinated, and there were 758. How can these two charts be so different? Right? So this is the correct chart, conveying to the people of Rhode Island the correct data. The Department of Health has not conveyed the data correctly. You can finish listening here if you like. I'm going to go into the analysis now and explain how it was done. All right. So I already described to you that I basically pulled the numbers from here. Just went through week by week by week by week, pulled all the numbers, and pulled all the numbers from here. All right. Took them over to an Excel spreadsheet and created a raw data chart. All right. These are the cumulative numbers. Okay, fully vaccinated and unvaccinated, as they call it. You can do the math on these numbers and come up with the weekly numbers. So these are the weekly numbers. Fully vaccinated, this is how many people came up positive that were fully vaccinated by week. And this is how many people came up positive by week that were not vaccinated. Now, it's very obvious what's wrong, at least to me was, and I'll explain it, is that prior to May or April, there weren't that many people vaccinated. So the bottom line is, of course, you're going to be front-loaded with lots and lots. Most of the COVID cases were in unvaccinated individuals. You changed the demographics of who you're testing in the middle of the year. That's the problem. Okay, so now let's go to the analysis I did. All right, let's start at the top. At the very top, first thing I did to make sure that my numbers were right and my analysis was right is I created the chart using their data. Okay, there it is. So I took the weekly and I took the cumulative for fully vaccinated and the cumulative, and the chart looks exactly like theirs. Okay. Then what I decided to do is say, let's create the same exact same chart based on the weekly numbers. So this is the weekly numbers. And you notice something right away. The charts look completely different. This is a trend analysis. What I just told you is, notice that before June, everybody was unvaccinated, and the people coming up positive in the weeks before June, of course they're all unvaccinated. Plus, it wasn't the Delta variant, it was the other variant. Something very unique. Then we took a nice lull in the summer. Very few people were being tested positive here. Then all of a sudden we took the sharp spike. I don't know why the sharp spike's here. It's probably the Delta variant, but as a statistical analysis person, I generally don't really care, right? All I know is the data. The data is telling me that after July, we took a sharp spike. And the other thing that happened is the number of people that were fully vaccinated coming up positive increased dramatically from back here. Look how tiny the red is back here. So now, by this chart alone, 31% of the cases are fully vaccinated if you do it on the weekly analysis. One other thing you can tell from this chart that is interesting, we keep hearing that the Delta variant is straining our system in general, right? I don't want to just say hospitals, but that there's a lot of Delta cases. It's very contagious. The chart indicates that that is not the truth. This was not the Delta variant. And look how big these numbers were back in these weeks. As much as 4,000 cases a week, 2,500 cases a week. Now all of a sudden, here's the Delta variant and the case count is down. My point is that we are not stressing our system at all here. What we've done is, for whatever reason, these numbers are actually down weekly. The overall total number has gone down. It's never climbed back up to the rates that it was. I'd say we were in pretty good shape. But what's alarming is that vaccinated individuals are now testing positive at very high rates, not like the media would have you believe that 99% or 90+% of the cases are in unvaccinated individuals. This is the data from the Department of Health. I didn't make the numbers up. These are the facts. Okay? So now I did a slightly different version of the chart just to showcase. I basically took just this portion. Why? I really don't care about what happened in the beginning of the year. I'm trying to observe a trend that happened with the Delta variant. This shows that trend. Okay? Now, instead of representing the data using the stacked line graphs like this, which are not the norm for trend analysis, there's a much better way. This is a much better way of observing trend analysis. This is basically a column, right, what we call a column bar chart. Here what we're showing is for each week, show me clearly, side by side. Don't stack it. I don't want to see it stacked. And when we get to like the week of 9/12, we have we'll call it 1,500 cases. 1,500 cases are unvaccinated, and 760, I'm just rounding them, right, are in vaccinated individuals. This is horrible, guys, and the Department of Health is not conveying this. They have deceptively and intentionally cherry-picked this chart type from the beginning of the year. This concludes my video. I hope I made my case and that you can really understand that the numbers coming out of the Department of Health are not truthful and they're very misleading. I'm not sure what to do with this information, but these are facts. This data was not made up. It came directly from the Rhode Island Department of Health. Thank you for listening.